then there's more severe deficiencies, which is beriberi disease.
Yeah, talk about that, please.
Yeah, there's 4 types, and we were discussing this, like,
Uh-huh.
getting back into our notebooks and and everything, but 4 different types: dry, wet, cerebral, and gastrointestinal.
Right.
So we'll touch on the main ones that may be more common out of these, the dry and the wet.
Yes.
Dry is more of a, I will say, like you discussed peripheral neuropathies, and that's what it is on a more severe level, where
Yeah,
the
basically severe. Yep.
yeah, and it's the like characteristic symptom is burning feet syndrome, and so we may notice like exaggerated reflexes, loss of sensation, muscle weakness, and then so that's dry, beriberi, and then we have wet, where this is introducing more of the cardiovascular symptoms. So enlarged heart, rapid heartbeat, swelling, difficulty with breathing, and congestive heart failure.
Yeah. Scary stuff.
Yeah.
Yeah, yeah. And then is basically, just out of curiosity, is like the cerebral beriberi, is that not fairly similar then to like Wernicke-Korsakoff
Right.
syndrome, basically,
Right.
right? Because as you were saying that, because a lot of the symptoms with the Wernicke-Korsakoff is severe confusion, severe memory loss, like people like actually having like almost blindness with vision problems,
Yeah.
and if severe enough, like people could actually lose entirely like nerve and muscle function and become paralyzed.
Yeah.
So all that's scary,
Yeah.
but we want to remind everybody in the
Right.
U.S., the thiamine is extremely rare that somebody gets to that level of deficiency.
Yeah.
But there are countries in the world that are developing countries that, unfortunately, this conversation is very real.
Right, absolutely. And with the cerebral, where you mentioned Wernicke's encephalopathy and Korsakoff's psychosis, it is most common too with alcohol consumption.
No question. Yeah.
So obviously, yeah, that. But yeah, all of those characteristics and Wernicke's can lead to Korsakoff's, and then they're together. It's like the syndrome of them together.
Yeah, there we go.
Had to look back in my notes for that one.
Well, thank you for clarifying on that. I appreciate that.
Yeah, well, how did we differentiate that? But yeah, one can lead into the other, and then they're just combined into a syndrome. So
absolutely. And then how about the gastrointestinal, really briefly?
So that's with high lactate levels, which can lead to lactic acidosis, and this is where it's difficult, because it's like, okay, is it specifically, thiamine deficiency, because the symptoms are, I guess, a little bit more broad or generic. So it's the nausea, vomiting, and then abdominal pain.
Yeah, right.
So there's probably more to the story as far as like, again, like, why are we getting that high lactate levels? What about absorption, etc.
Exactly.